Teenage rhinoplasty is an interesting aspect of rhinoplasty surgeons' practice because there are a couple of issues that are really important and differentiate this type of patient who's seeking to have rhinoplasty than an adult patient. And the key thing is that teenagers are bright, they're smart, they actually know what they want. And adults a lot of times don't really believe that. And in a lot of consultations, the parents get very involved in that discussion, which is fine because it's their right and they should. But it's my job to make sure that I understand what this young individual wants and make sure that it reconciles with the parents. And just if the patients are not, or the teenager is not ready to have surgery, it's my job to tell them, listen, you're not ready to have surgery, because sometimes it's the parents that are pushing them. Sometimes it's the teenager that's pushing the situation. Most importantly, we also want to make sure that their anatomy is appropriate to have surgery. There are, again, females and males age differently, and their bone structures and cartilage structures age differently. We usually wait probably till about 15 or 16 for most female teenagers, just because there's a higher level of maturity and their anatomy has finalized their growth. For boys, we generally wait till about 17, where they have a sense of maturity as well as their skeleton and cartilage issues are addressed. Now, a lot of people ask, why can't they have surgery earlier? Why is it? Because the septum, which is this internal midline divider of the nose, is actually, the cartilage is the growth phase and plate for almost the entire face. So it's not just the nose, but it is the entire face that this cartilage helps achieve growth. So if the surgery is done too early or too prematurely, you could get less growth of the mid-face area and the cheeks and so forth, and that could be detrimental later on and could change the shape of the face and the aesthetics of the face. So that's why we try not to do anything with the septum unless we absolutely have to, until the face has kind of reached its maximal growth.